Hi, myself Dr. S.K. Aminabi, Professor in the Department of Pharmacology from BV Institute of Pharmaceutical Sciences, Gujarat. Today I am here to discuss about the topic that is hypertension, and coming to the topic contents, we will be discussing here about what is introduction to hypertension, followed by pathophysiology of hypertension, that is classified into two types, primary as well as secondary hypertension, and the next one is the control of BP, that is which can be done by two methods, that is short-term control as well as long-term control of BP. Short-term control of BP is done by baroreceptors and chemoreceptors, and long-term control of BP it is done by renin-angiotensin-aldosterone system and antidiuretic hormone. And finally, we'll be discussing about classification of antihypertensive drugs. Okay. So coming to the first one, that is hypertension. We are all familiar with hypertension, that it is a common cardiovascular disease that is affecting worldwide population, and we can say, coming to the definition of hypertension, we can say it is the pressure that is exerted by the blood on the walls of the blood vessels. It can be considered as hypertension. Okay, and which is further classified into two types, that is primary as well as secondary hypertension. And primary hypertension, it is the most common type, and the specific or the exact reason for the rise in BP is not known. Such type of hypertension is considered as primary or essential, or it can also be called as idiopathic hypertension. Come to the next one, that is secondary hypertension, which may be due to renal, vascular or endocrine disorders. Okay. So here we can discuss about systolic blood pressure, diastolic blood pressure. Systolic blood pressure, it is the maximum pressure that is recorded during ventricular systole, and diastolic blood pressure, it is the minimum pressure that is recorded during ventricular diastole. So coming to the next one, that is pulse pressure. The difference between systolic blood pressure and diastolic blood pressure, it can be considered as pulse pressure. Okay. And next, the blood pressure, it mainly depends upon two parameters, that is cardiac output as well as peripheral resistance. Okay. So any one of the parameter increases, that is cardiac output increases, peripheral resistance increases, so finally the BP increases. So there is direct relationship between cardiac output, peripheral resistance as well as BP. Okay. And these are the normal levels of systolic as well as diastolic blood pressure. Coming to the next one, we have to see what is the primary and secondary. As I have said earlier, the primary hypertension, the exact reason is not known, and secondary hypertension, it may be due to adrenal disease or renal disease, or it may be stress, or may be due to hyperaldosteronism or sleeplessness. Okay, and hyper or hypothyroidism. These may be several reasons for the increase in BP, and it may be considered as secondary rise of blood pressure. Come to the next one, how the BP can be controlled. Okay, which is done by two methods, that is a short-term control of BP and a long-term control of BP. Okay, in the short-term control of BP, it is done by baroreceptors as well as chemoreceptors, and long-term control of BP, it is done by renin-angiotensin-aldosterone system and antidiuretic hormone. Come to the first one, that is baroreceptors. Okay, and these baroreceptors, they are present in carotid arteries, and these baroreceptors, they detect changes in pressure. So whenever there is increase in pressure or whenever there is decrease in pressure, that is identified by baroreceptors. That pressure changes are being identified by baroreceptors. So coming to the first condition, whenever there is increase in rise in BP, whenever there is rise in BP, that condition is identified by baroreceptors, and baroreceptors, they act on two vessels, that is blood vessels as well as on the heart. Okay, on the blood vessels, there will be increase in sympathetic activity. There will be decrease in the sympathetic activity. So whenever there is a rise in BP, the baroreceptors, they will be acting on two organs, that is blood vessels as well as on the heart. Okay, On the blood vessels, there will be decrease in sympathetic activity, so their blood vessels get dilated. And on the heart, there will be increased parasympathetic activity, there will be decrease in heart rate, there will be decrease in force of contraction, and so finally there will be decrease in the cardiac output. So whenever the blood vessel gets dilated and whenever the cardiac output decreases from the heart, the blood pressure will be decreased. Okay. So coming to the next condition, whenever blood pressure falls. Okay. Again same, this condition is identified by the baroreceptors, and baroreceptors will be acting on two organs, that is heart as well as blood vessels. On the heart, there will be decrease in sympathetic activity, so that there is increase in heart rate, increase in force of contraction, and so finally the cardiac output increases. Okay. And on the blood vessels, there will be increase in sympathetic activity and there will be vasoconstriction. So whenever the blood vessel gets constricted and the cardiac output gets increased, so finally there will be increase in the blood pressure. Okay. So this is how the baroreceptors they regulate the BP. Okay. And coming to the next one, that is how the chemoreceptors will be acting. Chemoreceptors. Okay. And same, these chemoreceptors are present in carotid bodies. Baroreceptors, they will be identifying the pressure changes, whereas these chemoreceptors they identify the gaseous changes. So whenever there is increase in the partial pressure of carbon dioxide or decrease in the partial pressure of oxygen, this condition is identified by chemoreceptors. And the chemoreceptors they send information to CVC, that is cardiovascular center. Okay. Depending on this cardiovascular center will react, that is there is increase in stroke volume, there will be increase in heart rate, there will be increase in vasoconstriction, that is again it will be acting on two organs, that is heart as well as on the blood vessels, and finally there will be increase in the BP. Okay, that is first condition. Whenever the partial pressure of carbon dioxide increased or the partial pressure of oxygen is increased. Okay, come to the next condition, that is whenever the partial pressure of carbon dioxide is decreased and partial pressure of oxygen is increased. Again same, this condition is identified by chemoreceptors, and chemoreceptors they send information to cardiovascular center, and cardiovascular center, okay, there will be decrease in stroke volume, decrease in heart rate, and there will be decrease in vasoconstriction, that is nothing but vasodilation will occur. There will be decrease in the BP. So in this way, these two, that is chemoreceptors as well as baroreceptors, they will regulate the BP and it can be considered as short-term control of blood pressure. Okay. Come to the next one, that is a long-term control of blood pressure. Here we will be discussing about 2 points, that is renin-angiotensin-aldosterone system and followed by antidiuretic hormone. Okay. So come to the first one, renin-angiotensin-aldosterone system. Okay. Here the condition is whenever there is low renal blood flow, that is whenever the blood volume decreases or blood pressure decreases or blood sodium level decreases. Okay. This condition is identified by kidneys, and kidneys they secrete renin. Okay. And this renin, it will be converting angiotensinogen to angiotensin 1. Okay. And this angiotensin 1, in the presence of an enzyme, that is angiotensin converting enzyme, it will convert angiotensin 1 to angiotensin 2, and angiotensin 2 will act upon adrenal cortex. Okay. And these adrenal cortex, it causes a secretion of aldosterone, and these aldosterone, it will act upon kidney tubules, and so there will be increased reabsorption of sodium and water and increased excretion of potassium. Okay. So finally what happens? There will be increase in blood volume, increase in blood pressure, and increase in blood sodium levels. So the condition what we have given earlier, there is decrease in blood volume, decrease in blood pressure, and decrease in blood sodium levels. So finally, because of renin-angiotensin system, okay, there is increase in blood volume, blood pressure, as well as blood sodium levels. Okay. So this is about long-term control of BP, which is done by renin-angiotensin-aldosterone system. Okay. Come to the next one, that is antidiuretic hormone. Okay. And so the condition here is when the blood osmotic pressure is raised. Okay. This condition is identified by osmoreceptors that are present in the hypothalamus, and they send information or they stimulate posterior pituitary gland, and this posterior pituitary gland, it secretes antidiuretic hormone. So this antidiuretic hormone will cause increased reabsorption of water by the kidneys. So finally, the blood osmotic pressure will be lowered. So the condition is blood osmotic pressure is raised. Okay, so here because of these release of antidiuretic hormone from the posterior pituitary gland because of osmoreceptors, and these antidiuretic hormone will cause the increased reabsorption of water by the kidneys, and so finally the blood osmotic pressure is lowered. Okay, so I hope all of you have understood what is hypertension, what are the types of hypertension, followed by control of hypertension, which is done by two methods, that is short-term control as well as long-term control of hypertension. Come to the next one. Let us go with the classification of antihypertensive drugs, which are classified into 7 types. Okay, so come to the first one, ACE inhibitors. Those are captopril, lisinopril, lamipril as well as benzapril. Okay, come to the next one, angiotensin 2 receptor antagonist, that is losartan, candesartan, valsartan as well as telmisartan. Okay, come to the next one, direct renin inhibitor, that is eliscarine. Okay, if you see all these 3 ACE inhibitors are angiotensin 2 receptor antagonist, direct renin inhibitor. If we understood renin angiotensin aldosterone system, we can write the mechanism of these 3 drugs, of the 3 class of drugs. Okay, come to the next one, that is calcium channel blockers, that is diltiazem, verapamil, nifedipine, amlodipine as well as felodipine. Okay, come to the next one, that is diuretics. Okay, which are further classified into 3 types, that is thiazide diuretics, loop diuretics as well as potassium sparing diuretics. Okay, and coming to the next one, okay, we'll be discussing about each of these classes in detail. Next one is the thiazides, chlorothiazide, hydrochlorothiazide, chlorthalidone, they come under thiazide diuretics. Come to the next one, that is loop diuretics. Those are furosemide, bumetanide as well as torsemide. Okay, potassium sparing diuretics, those are amiloride, triamterene as well as spironolactone. Okay, come to the 6th class, that is sympatholytic agents. Okay, which are further classified. They are centrally acting adrenergic drugs. Those are clonidine as well as methyl dopa. Ganglionic blockers, that is trimethophan. Neuronal blocker, that is reserpine. Beta adrenergic blocker, that is atenolol, metoprolol, ismolol, propranolol as well as thymolol. And alpha and beta adrenergic blocking agents, that are labetalol as well as carvedilol. And last one, that is alpha adrenergic blockers, selective and as well as non-selective. Selective, they are prozosine, terazosin as well as doxazosine, and non-selective is phenoxybenzamine as well as phenetolamine. Okay, coming to the last class, that is vasodilators. Okay, vaso is nothing but a blood vessel. These vasodilators are further classified into 2 types, arteriolar dilator as well as arteriolar and venodilator. Okay, arteriolar dilator, they dilate only the arteries, and the drugs are hydroxyl minoxidil as well as dioxide. Next one is arteriolar and venodilator, and the drug is sodium nitroprusside. Okay, so these are the 7 class of drugs which are used as an antihypertensive drugs. Okay, so I think in this video we have discussed about introduction to hypertension, followed by types of hypertension, and followed by control of BP, which is done by short-term control, baroreceptors, chemoreceptors, long-term control, renin angiotensin aldosterone system, and antidiuretic hormone. And next we have discussed about classification of antihypertensive drugs, and I hopefully think you have understood this video, and in the next video we will be discussing in detail about each class. Thank you. Have a great day.